When you're doing oral drugs, as I said, you start titrating. Reduce the oral drugs. Metformin you should continue. Sulfonylurea should reduce to half. DPP4 and SGLT2 inhibitors, in fact, should be continued because they can help you to reduce the dose of insulin. So this is how what you should be doing with the oral drugs. Premix, of course, premix is an alternative. You can initiate with premix insulin, initiate of basal insulin, and you can start with a starting dose of 10 to 12 units at the dinner time, and then slowly titrate. Now, premix has to be titrate very slowly after 3 days, after 1 week also, because premix has a lot high risk of hypoglycemia. So start very slowly and then keep titrating. Now, which blood sugars you will monitor? That is very, very important with premix. You have to monitor post dinner sugar and fasting sugar if you are giving a shot in the night, so that you see their post dinner sugar is under control or fasting sugars are under control. These two sugars are very, very important. Other sugars you may not monitor, but these two sugars are important when you initiate a premix insulin in the night. So post dinner sugar and one fasting sugar, you can adjust the dose as per this, and every week you can up titrate slowly. Once fasting sugars are at target, stop titrating. Now, once you see the sugars, fasting is under control, but post dinner sugar is still slightly on the higher side. Don't adjust the insulin, because otherwise you'll get a fasting, you'll get a low sugar in the night. So stop titrating. Instead, you can add some oral agent, maybe a acarbose or something at the dinner time, so that you are able to control the postprandial. If you want to continue with the premix, then you add some oral agent at the dinner time, so that his postprandial sugar or the post dinner sugar should drop, or counsel the patient to reduce the carbohydrates. But don't titrate the insulin once your fasting sugar is under control. Remember that with the premix insulin, because otherwise you will have a hypoglycemia if you try to control the postprandial or post dinner sugar more by increasing the dose. So premix insulin you can start with 30/70, but you can intensify with 50/50. So you can split the dose. Like if you want to continue with 40 units in analog insulin, when you suppose you want to start 2/3 of the dose in the regular insulin and 1/3 in the night. Suppose your total dose of the patient is 40 units and you want to give 40 units of insulin, then 2/3 of it, that is 24, should be given in the morning and 16 in the night. But for analog insulin, there's no such need. You can give half and half, half in the morning, half in the evening. That will suffice. So equal breakfast and dinner doses should be given, and titrated doses preferably once a week slowly. As I said, you discontinue as sulfonylureas, reduce to half, and TZDs should be continued. Sometimes we discontinue because of the weight gain issue, and then slowly you titrate like this. If your sugars, pre-meal sugar, you give a 2 shots of premix insulin, one in the morning, one in the evening. So for the premix insulin, for the morning shot, you will look at the post breakfast or pre-lunch sugar first and the pre-dinner sugar. So pre-lunch and pre-dinner. Once your pre-lunch is okay and pre-dinner is okay, that means premix which you are giving in the morning is fantastic. It is working fine. Your post-dinner, post-breakfast sugar is going to get control. Because if you want to titrate the premix in the morning and you are going to go up and up and up and up, what can happen? The pre-lunch time, the patient is going to have a hypoglycemia. Remember, I told you there will be two peaks. One peak for the breakfast when the going is going to peak, and one peak is going to come after 4 hours. That is just before the lunch time when the hypoglycemia is maximum. So that's why you should look at the pre-lunch sugar and look at the pre-dinner sugar in the morning shot. For the evening shot, look at the post-dinner sugar and look at the fasting sugar. And this is the way you can up titrate your premix insulin. This is a case which I have taken just to give you a simple explanation. This is patients who has type 2 diabetes since 15 years. A1C is 8.2%. He's on 30/70 insulin, 12 units at a dinner time. Metformin is 1 gram. Teneligliptin 20 milligram. Glimepiride 2 milligrams once daily in the morning. Creatinine is 1. GFR is normal. You can see the fasting is under control. With post-dinner is under control with 12 units of insulin. But you can see the pre-dinner sugar is high. The pre-lunch is also high. So you can safely initiate second shot of insulin in the morning at fastings, which will take care of the pre-lunch and pre-dinner sugar both. Automatically, all these sugars will get controlled with one shot of insulin here, right? So already you are controlling the post-dinner and fasting. Now you have to control these sugars, and the fasting in the morning before breakfast, one premix will definitely give you a good control. So start slowly again 6 units, then slowly up titrate every 2 units, and then slowly we had been you will able to titrate to 14 units, and with 14 units in the morning and 12 units in the night, her sugars have come under beautiful control with A1C of 7%. Now once you are going up, if you are going third round, sometimes we give 3 shots of premixed insulin. Very dangerous, cause the hypoglycemia. So start reducing the dose by 20% each time. When you are reducing, we are giving 3 shots. Then each meal you have to titrate. You have to titrate, and you have to tell the patients to come with the blood sugars frequently so that you can titrate it better. And every time you have to reduce the pre-breakfast and the pre-dinner doses by 20%. If you're putting an extra shot of pre-lunch here to titrate, sometimes people use 3 times a day, so that be careful, and you have to reduce the 2 other shots by 20%.